Okay, so what is BUS? BUS is basically a software that help collecting all this information and producing the results. I will show you just briefly the final page containing the results of the application of PASS, and it's like this. It's a single page, like a dashboard that contain all the characteristics of the project. So, trying to follow what we said before, I have a set of indicators that are countable, that are describing me the situation that I found on the field in terms of health facilities, and then I've generated, I have constructed my proposal. I have the description of the health context in terms of indicators, and I have the impact of my project in that context compared to a certain set of targets that I completely can adjust to my project. Of course, I have also the description of the project itself. So we're talking about the construction. I have a recap in this page of the main characteristic, the main surfaces of each department. I have the full profile of the human resources per position, and then we will see all the details later. That are required to run that hospital, and of course I have the main management parameter, that is the budget. I have the budget for the first year divided in lines, and once I have all this information, it's also easy to project along the years what are the financial requirements for such a proposal. So I will go back to the presentation, because this moment it's the only way I can do it. But basically, the software is having different pages that are following the steps of the evaluation. So we start with the health needs analysis, and the first step is to go and define where we are, so the administration level, the population, and this kind of information. Once we got this, we move to the second step, that is the full description of the facilities, the mapping. So we have a fixed set of information that we collect that describe completely the facilities that we are mapping. So what kind of services they provide, the staff that they have in a standardized set of categories, and what are maybe the most important parameter, what are the volume of activities that they have. Once I have this information, I can explore it. I can make the set of analyses that are required for the definition of a strategy. I define a certain area, and I go, and for that area I filter all the information that I have in terms of services that are provided, in terms of staff that are available, and volume, so I can see and I can analyze where the gaps are. Once I have this set of information, the software is also providing a kind of a general assessment methodology. In this case, the methodology has been been used by a methodology enforced by the WHO, where all these data are aggregated with a standard set of indicators that are basically analyzing the availability of services in a certain area. The software allows to either use the same set of targets, because the situation is plotted against a certain a defined set of targets, or if you want, we can fully customize this reference to our own targets. So we can say, okay, for me, the number of facilities, the average number of facilities should be 4 facilities per 10,000 people instead of 2 as proposed by WHO, and stuff like that. The same exercise can be replicated in terms of services. So I have a full pictures of what is the situation and what I believe should be the situation. And according to this discrepancy, I can target an intervention. And then it's the moment of, okay, the proposal part. I have defined what are the gaps that I want to cover. So I said, okay, I want to go for a certain facility providing a certain services. We do have internal guidelines. So I have in this page a kind of a recapitulation of what are our standards. So for example, here you see that I choose a neonatal department, and in this scheme, if I click here, I see what are the compulsory services that should be attached to a neonatal department. And I can further develop this according to the kind of configuration that I want. If I want a basic configuration, if I want a typical or an advanced one. And of course, increasing the complexity of the layout, I will have more resources to deploy. So I already have a picture of the relation between services. Then we have guidelines saying that, okay, how it should look like internally. In this case, I click on obstetric departments, and then once again, according to the chosen setup, I have the full list of spaces, functional spaces, that should be available if I choose to build this kind of services. And then let's say once I make again, I study what MSF is using as a reference, I can actually design it. So I can go for the configuration of my facility. I can choose the service that I want and the configuration that I want. Once this is done, I go for each department. The tool is telling me, okay, if you make obstetric, you have a waiting area, and you should tell me how big is that waiting area. Or if I have a ward in internal medicine or whatever, you should tell me how many beds I want. There are also other functionalities, and everything is recorded in the system. Once I've done the physical sizing, I have to move to the staff sizing. I have to populate my facility. So here I have a first form where I should insert the data related to the labor law. How many hours I can work in a week, how many holidays I have, all this information about the shift, how I divided the shift per department, because of course the emergency department is running in a completely different way than the kitchen or whatever, and I have to insert all this data. Once I have this, I have to go for the actual staffing, for the positions, and the system is already providing a set of all the position and a set of nominal ratio, let's say average ratio of a position. So I should have one medical supervisor, for example, every 150 bed. I should have a medical specialist every 60 bed, so on and so forth. The system then is providing average values, but is also allowing the user to choose every time the ratio and therefore the number of staff that they want in a full customizable way. Of course, the staff for the whole management of the facility is also included, and in this case I came up with the whole requirements for the facility. In the next page here I have a recap of the how the facility should look like, so in terms of surfaces, in terms of specific services like for example water and sanitation, how many latrines should I provide according to the service that I have, and this also allowing to say, okay, if I have a maternity I will probably have more women than men, so I have to design my latrines according to these needs. But more importantly, I have the full list for each department, for each room, already the size of the room according to the specification that we have, so according to the number. I have even the number of room that, for example, if I have a ward, I know that I don't want more than 12 beds in a room, because otherwise the nurses can't really follow up the patients. So I have limits that the system knows and say, okay, if I have 18 beds, I will need 2 rooms to accommodate those beds. I will have exactly in each room the number of water points for hand washing. I will have the number of power plugs. I will have the typology and the number of windows. I will have the ratio of natural lighting in each room that is provided with this set of windows. I will have the finishing, how the floor should look like, if it's concrete, if it's tiles, if it's ceramic or whatever. I will have the walls and the doors, and this for all the rooms in the facility. So, and this is fully accomplishing our internal guidelines, and this is the result that should be given to the architect to produce the final drawing. So all this information is internalized, let's say, in the software, and eventually can be modified. What means eventually? It means that if we have a standard and we say that for MSF the space around the bed should be 4.6 meters, this is a standard. And of course it's not written, it's not the word of God, can be changed, but according only in certain conditions, because we want to build, at least initially, a facility that respects our standards. So then, once this is done, I can go to the forecast. I can go to the final step, where I see exactly what are the impacts, what are the consequences of my design. So, for example, I can insert a certain few parameters like bed occupancy rate, like average length of stay, and I can predict what will be the impact, as I was telling before, and I can really define a target of activities that should be respected during the running of the operation. I have here as I said before, the full recap of the staff that is required per position and categories. And then I have the budget. I have the line for the first year, so for every budget line is described, and once again there is this approach that there are standard values that are proposed, but they are fully customized, and every time you can adjust to the price that you find in your context, to the specific decision that each time you can insert in the scheme. And as I said, once this is available, you can produce a forecast, a financial forecast in the years, with here it has been implemented with considering all the financial parameters like inflation and full customization, and this will provide the let's say the forecast in the long term. So as I said, everything is then resumed in this dashboard that it's providing a kind of synthetic view of the proposal. So this is PAS. This is actually the tool, and why is in my opinion is an answer to what we discussed before. It's actually helping to link the context and the strategy. Is defining. It's actually straightforward linking the quality that is expected and the specification of the facility, because it's following our own guidelines, and at the end is linking the initial strategy, the resources that are considered to be deployed, and the impacts. Even more, if it's applied in different contexts, it's provide a kind of institutional memory of all these parameters. It's providing a depository for the specification, for context data, and at the end is supporting a decision making and a management based on indicators that can be followed and monitored. And that's it. I will close here. These are other potential application and advancement that can be done to the model. But once again, I want to stress that PAS is a tool, but is conceived as part of a process and a part of an approach. The tool itself is maybe funny and nice, but is the overall approach that should be considered. Thank you.